Hello and welcome to our presentation on self-care. This is Bita Parto and Fatima Minhaj presenting to you our topic today. Self-care. What is self-care? What activities fall under the category of self-care and how many types of self-care are there? Today we're going to answer all those questions and more. We're going to talk about how self-care can relate to our mental and physical health. Self-care can be any behavior that is under our control. It is deliberate and self-initiated. It is an act that refuels us rather than taking away from us, as said by Agnes Weinman. This is a cat engaging in some quality meow time. When we think of self-care, we think of me time, time that we put aside to do things that are good for us, good for our health and good for our body and good for our mental health. The first trick to self-care is knowing what it is that we need to do in order to take care of ourselves. Knowing what is good for us and what's not good for us. Then we have to actively engage in a set of activities that will make our mood better, that will lift us and take care of our body and mind. Or avoid engaging in activities that will make us feel bad and that are not good for us. Perhaps like smoking. When looking at this image, we might immediately think about pampering. Pampering ourselves, especially as women, can be a powerful way to do self-care. A little pedicure, manicure, time to ourselves, candles and bath bubbles. These are all part of self-care. And these, as we will show you today, can have good impacts on your mental and physical health. Let's talk a bit about the history of self-care. Is self-care new? Definitely not. Self-care has taken many different forms over the centuries, but it has been present for a long, long time. In recent decades, self-care was a term used medically for patients who looked after themselves after being released from the hospital or maybe during hospitalization. There is no one definition of self-care, of course. Beautifying yourself, for example, is one form of self-care. Putting makeup, doing your nails, getting your hair done, all fall under the category of beautifying yourself. Makeup, for example, has been used since a long, long, long time ago, and it can be called a form of self-care. However, the emphasis on self-care as a form of pampering yourself and putting time only for yourself to take care of you is a recent idea. Let's look at this list. This list just shows some of the things you could do to do self-care. For example, women who engage in self-care could do the following: apply a face mask, conditioning their hair, going for a drive, having their favorite dessert, painting their nails, coloring a coloring book, or writing in a journal. Now, there is 4 types of self-care: physical, emotional, psychological, and spiritual. Let's talk about what each of these can entail. Physical self-care is the most obvious form. Eating healthy means taking care of your body. So does exercising and sleeping on time. And there is also the aesthetics. Getting your nails done, putting makeup, looking good. These are all part of physical self-care. There is also emotional self-care. Having a nice emotional balance, not feeling too sad and too happy all at once, can mean that you're taking care of yourself emotionally. You could do that by laughing and enjoying things, or by crying when you feel the need to, and allowing yourself to feel those emotions. Being happy and complimenting yourself can also be an emotional self-care act. There could be a bit of overlap now with psychological self-care. Psychological self-care is how we take care of our mind. what we feel in our brain has a lot to do with how we feel in general. When we're stressed, dealing with that stress in a way can be a self-care. Or how we view ourselves and engaging in activities that better the view of ourselves can be better for our mental health. Saying no to things that come up when you're overwhelmed can also be a form of self-care. By doing all of this, you're taking care of your psychological self. Spiritual self-care is another form of self-care. It could be religious activities if you have faith in God and practice a certain religion, like praying, or it could be meditating, spending time in nature, winding down and finding your soul and feeding your soul. That's part of spiritual self-care. There's a study by Hansen and colleagues done on self-care and well-being. This study asked people what self-care strategies they did in their daily life and also asked them to report how good they felt and what their reported well-being was. The reported categories of self-care that people engaged in included things like social support, physical exercise, relaxation, doing pleasurable activities, and planning or setting limits. The study did a multiple regression analysis to determine the relationship between well-being and the different self-care strategies used. And of those categories that I mentioned previously, some of them were positively correlated with well-being, meaning that as those self-care strategies were used more, it was related to having better well-being. 4 of those categories that were positively correlated are social support, meaning having friends and family that you can talk to and spend time with. Social support is a way of taking care of your psychological and emotional well-being. This was the most strongly associated factor with well-being. Those who were strong with social support also showed mostly high well-being. There was a strong correlation between self-care as a form of social support and well-being of the person. Following social support was physical exercise. Physical exercise is very important. When you take care of your body, your perceived well-being also increases, and that seems to make sense for most people. Another one was relaxation. People who reported engaging in a lot of relaxation exercises had relatively higher well-being scores. And as you can see, relaxation can include a variety of different things. But as shown in this picture, a nice bath, a relaxing, peaceful bath with maybe some bubbles or some roses can be really helpful to make you feel good. Another thing was physical health. This is not to be confused with physical exercise. This is how we take care of our body, eating healthy and sleeping well. People who reported nice diet and good sleep hygiene and taking care of themselves by not smoking or drinking too much had better scores on well-being as well. This concludes this study done by Hansen, which shows that some self-care strategies are highly correlated with our well-being. This can have important implications. Now we can talk about self-care and quality of life. There was another study by Gonter and colleagues that talks about quality of life and how self-care affects that. 262 clinical psychology doctoral students were asked to rate their programmatic perceptions of self-care emphasis and their perceptions of self-care and quality of life. So, they found that programmatic perception of self-care emphasis was a positive predictor of quality of life, and this relation was partially mediated by perceived personal use of self-care strategies. To put it simply, those who saw the program as giving an environment where self-care could be practiced perceived higher quality of life, and this was because they saw themselves practicing more self-care strategies. Self-care is necessary for graduate trainees because it is affecting their quality of life. So the study suggests that it is important to maybe make some systematic changes to promote the culture of self-care and enhance quality of life of students. In this case, graduate clinical psychological students. The same could be said about women in health service psychology programs. Women in these programs are shown to have higher stress levels. The study by Ayala and colleagues tested the extent to which self-care activities moderated the negative association between stress and quality of life. 558 women participated in this study. Self-care could be any activity that is promoting your health. Women who were enrolled in these psychology programs took less time out for self-care. They had higher stress, and so they had less time for self-care because they were preoccupied with their professional demands. The study also has two other points that are important for our presentation. Self-care is prioritized if people around you model it and expect you to do the same. In the picture, we can see a mom teaching her daughter about makeup and hair, but it can go beyond just the aesthetics. It can be about how you take care of yourself physically, mentally, emotionally, and spiritually. When there is a person who is modeling self-care for us and expects us to do the same, self-care becomes our priority. So, the suggestion from this study was that faculty and departments should implement assessments and workshops that help monitor levels of self-care and help induce activities of self-care for these psychology women. As the study shows, as stress goes up, the level of self-care is lowered. There is a negative relationship between the two. Another study shows the same thing in the opposite way. When we increase our self-care activities, our stress tends to be lower, and the two are related again. Better self-hygiene practices in this study showed a relationship to lower levels of perceived stress. This study, done by Myers and colleagues, shows how psychology grad students filled out a survey of self-care practices that they engaged in, and they also reported their level of perceived stress. And it showed that the more they engaged in self-care practices, the less stress they reported feeling. Some of these practices that they engaged in were having strong social support, so engaging in social activities with friends and family, having a good sleep hygiene, which is physical self-care, emotion regulation, and mindfulness. Mindfulness is when we accept the world as it is and we don't constantly worry about the negative things around us. This can overlap with emotion regulation. Overall, people who engaged in these self-care techniques showed less perceived stress. In addition to those stress and self-care relationships, we want to know if self-care can have any clinical importance. We couldn't find much data on this topic of how beauty treatments or self-care practices could have a clinical importance in treating diseases. However, a study from 1970s by Coppens observed psychotic patients who were too disturbed to engage in any other group activities over a 2-year period of time. What this psychiatric hospital did is that they had a beauty treatment weekly for these patients. Every week, these patients got a facial massage, cleansing of the face and the skin, and they had their makeup done for them. This was free and provided for them every week. What Coppens did is that he analyzed and observed these patients over this 2-year period. In comparison with those patients that did not engage in the beauty treatment, he saw faster social readaptation and better interpersonal relationship in the patients who did go through the beauty treatment. This study is not conclusive on the effects of self-care and aesthetic treatment for patients, but it can provide hope for the future to explore this topic further. These are our references and the sources we used. I would like to bring your attention now to our discussion questions that we will be posting on Moodle. Please take some time to read and answer questions, and post any questions that you may have about self-care and how it affects our well-being and quality of life. I hope you enjoyed.